Welcome. My name is Margaret Shield and I use she, her pronouns. I'm the coalition organizer for Washington Breeze, and these sessions are for our coalition members and our partners who support our vision statement. And just before we get started, I'd like to offer a land acknowledgement that those of us here in Washington State are gathered on the lands of the Pacific Coast Salish and the Plateau tribes. And we want to recognize and honor their contributions to our state's history, culture, and economy, and make this acknowledgement as a reminder of the need to work together for a more just and equitable society for everyone. So we're really pleased today at Washington Breeze to welcome Marcela Gaitán to our Learning Circle today to share information and ideas with us. Marcela will be explaining the work of the Nuestras Voces Adelante Network of the National Alliance for Hispanic Health. And she'll explain about when questions are welcomed. And with that, I'm going to just turn the session over to Marcela. Thank you for being here.
Thank you, Margaret. Thank you, everyone, for attending today's meeting. Like Margaret mentioned, I work with the National Alliance for Hispanic Health, and I'm the program director for the Nuestras Voces Adelante Network program. Next slide, please. So this is just an overview of today's agenda, which I'll talk about some of provide some details in terms of what Hispanics and tobacco use, some of what the data shows on that, some information about the program, about the Alliance, and then some information on the resources that we have in some of evidence-based interventions also specific for Hispanic related to commercial tobacco control. Next slide, please. So the Alliance, we're a nonprofit public health organization, was based in Washington, D.C., and we work with a network of community-based organizations that serve over 50 million people around the country. We are the largest in all this network of these organizations as well. We do a variety of health promotion and health education programs, and our mission is best health for all. Actually, I wanted to emphasize that the core value of the work that we do is that we believe in community-based solutions, and we do not take any funds from alcohol, tobacco, or sugar-sweetened beverage companies. Next slide, please. So this is actually the building of our organization here in DC. And we're a membership organization. You know, some of our members include foundations, national organizations, some individuals as well, hospitals, universities, students, and consumers overall. Next slide. And just, thank you. And just to put things in perspective, just to give you an idea, as of the most recent census report, actually, this was 2022, some of the estimates, it shows that Hispanic represent over 19% of the population. Next slide. And it is projected by the 2030, the Hispanic will represent 21%, and then by 2060, it will be 28% of the population. Thank you. Next slide. So just in terms of, oh yes, hold on a second. Let me just mention that if anybody, let me open my chat here. And if anybody has any questions during the presentation, feel free to maybe put them on the chat and I'll be happy to answer. Or you can actually unmute yourself as well if you have any questions. So just to give you some perspective in terms of smoking prevalence among Hispanics. Historically, Hispanics have among the lowest prevalence of tobacco use among adults in compared to other racial ethnic groups. However, if you look at the Hispanic subgroups, the rates are very different. It goes from like Puerto Rican showing as high as 28% from data. I believe that was 2016. It's a little less now based on most recent data. And also, you know, you look at the rate, but for Cubans, 19%, Mexicans, 19%, or Central and South Americans, 15.6%. And even though, like I said, the fact that overall Hispanics, the rates are lower, this is despite of the targeting of the industry and how they influence the community in terms of providing funding for like cultural events, for example, giving scholarships, also conducting specific campaigns, and some of them are actually bilingual campaigns. This is a way to attract the community, to make them look that they are the good people in the neighborhood. And also other ways that they have targeted the community, like sponsoring, for example, the Cinco de Mayo events that many communities have around the country. Next slide. When it comes to secession, more than half of the Hispanics report that they want to quit. And this is also compared among non-Hispanic Blacks and among non-Hispanic whites and Asian and Pacific Islanders. However, when you look at the data and reports from the like recent studies, I quote here a study from CDC, which is a relatively recent study from 2022, I believe, where they reported that among Hispanics who visit providers, they're the group less likely to receive advice for quitting. And they even did it among Hispanic subgroups as well. And they saw that Mexican smokers have a lower prevalence of cessation treatment use than non-Hispanic white smokers during the same period. That meaning they're not asked about their smoking habits or their smoking practice, I guess. Also, Hispanics tend to report they are highly motivated to quit. And they usually report that they want to do it for their family, they want to do it for their children, to protect their children. So this is a great opportunity to address the issue among communities. And also, another thing that is important to highlight here is like Hispanics are the group less likely to use nicotine replacement therapies. And the reason is because, first of all, they're not asked by providers if they smoke or not. They are the group less likely to be asked or given advice about smoking. And there is also, there are some misconceptions also about the use of NRT medications. From our community partners, what we have gathered is that sometimes Hispanics who are advised to use NRT, for example, they think it's they don't want to use it because they maybe show some weakness. They want to do it on their own, or they don't want to take any, they don't know much about how it works. So they feel like they don't want to take any more medications if they're taking other medications. So it is interesting to see, the perceptions about NRT. Next slide. And now that although Hispanics adults, like I mentioned before, have had historically some of the lower rates of tobacco use, our problem is now that the youth are not following that path, unfortunately. Like the data, even the most recent data, even since 2011, when CDC began to collect data on Hispanic youth, on youth, and from different races and ethnicities in terms of e-cigarette use, Hispanic kids tend to be the ones that show most likely to use e-cigarettes and overall tobacco products, and that has been consistent throughout the years. And in fact, the last one, I think I put the most recent data point here, where it shows that the current use of any tobacco product, 10.3 among Hispanics, compared to 4.1 among their non-Hispanic white peers and the 8.5 among the non-Hispanic Black peers. And we're talking about middle school kids. So you see how young they're starting to use these products. And also, and we look at his e-cigarette use as well. We see 6.6 among the Hispanic youth versus 3.1 and 5.7 for the non-Hispanic white and non-Hispanic Black peers, respectively. Next slide, please. And this is, again, like I mentioned before, this is also from 2020, and it shows the same, that Hispanics tend to have higher rates of tobacco products. And this is what we call the tipping point. And what we mean is this, that even though, adults are not smoking as the rates are not as high as in compared to other groups. However, because of the youth use of these tobacco products, we see that this is going to be presents a risk for the future, for adolescents right now. When they grow to be adults, they're going to have, serious of chronic diseases because of their nicotine addiction. So this is what we call the tipping point, that again, like, you don't see as much among adults, but then among the youth, the use of tobacco, will lead to having chronic diseases when they grow to be adults. Next slide. Okay, so I mentioned that the use of higher use among youth and e-cigarettes, and I'm sure you see the same situation in Washington State. So they have that. There is a lot of misconceptions about the e-cigarettes, for example, how kids are attracted because of the flavor they are being offered with the different products. And it's also they believe that the e-cigarettes are less harmful than the combustional, cigarettes as well. And then also they believe that the vapors are not as bad as smoking a cigarette. Next slide. One of our partners for the Nuestras Voces program is the Food and Drug Administration, and they're doing very interesting research in gathering actually qualitative data for tobacco use among youth, and they did some interesting work on Hispanic youth and acculturation. And some of the things that they found, this is kind of similar to what they found. This is from another study from 2019, some of the perceptions and knowledge and attitudes about use of cigarettes, and then, or even e-cigarettes. For example, on this, the FDA showed that for the students, for the youth, they mentioned that, there's very easy access to get these products. They also look cool. They're easy to conceal. And that's a big concern for us, because we know that, and this is again from our community partners, parents, there is a big need for parents' education when it comes to e-cigarettes, because many parents do not even know that the kids are using these products, because, the way they don't look like a regular cigarette. So parents have no idea that these are actually tobacco products that contain nicotine. There is also, like I mentioned before, the flavors make them very attractive. And it's interesting to see also, they mentioned that there is a level of curiosity, because they see some of their family members using this product, so they also want to try it. And they talk about among themselves and say they wanted to see how they feel. They wanted to try this product and see how they feel. Next slide, please. So as I mentioned before also, the Alliance is implementing Nuestras Voces Adelante Network program, and we're one of the 9 organizations that are funded by CDC to address commercial tobacco use prevention and controlling cancer prevention and control among priority populations. Our focus is best health for all, but we focus for this program particularly on Hispanic communities. So there are 4 strategies for the program. We have a national network, which I'll invite everybody to join. It's very easy. Just go to the website and join, and don't have to pay or anything. And then you can just get information about our webinar, the resources that we develop, and other type of news. And even we can also collaborate with, if need, provision of technical assistance as well, in training and technical assistance. So we also are conducting right now a community of practice, which is it's called the Cancer Prevention. It's the Tri-Networks Cancer Prevention Community of Practice, and we're doing it in collaboration with 2 other of the other networks, the GEA, which is the Geographic Equity Alliance, and also with the Self-Made Health Network. So with the 3 of us, the 3 networks are collaborating in this community of practice for cancer prevention, and we're providing technical assistance to 5 states, including it's in Nebraska, Mississippi, Colorado, New York, and we're also working with Cherokee and in Oklahoma, the Cherokee Nation in Oklahoma as well. And then as part of the program, we also collaborate with community partners. We have 4 community partners around the country that help us amplify the reach of the program. We work with the Cancer and Chronic Disease Consortium in El Paso, Texas, the Chicago Hispanic Health Coalition in Chicago, Family Health Centers of San Diego in San Diego, and Juntos Center for Advancing Latino Health. And there is interesting thing about these organizations that are very different. Like, for example, Family Health Centers of San Diego is federal qualified community health center. Juntos is an organization within the Kansas University Medical Center. Chicago Hispanic Health Coalition, as the name mentioned, is a coalition. And then the Cancer and Chronic Disease Consortium is a nonprofit organization led by community health workers. Next slide, please. Now, some of the things that we do with the work on Nuestras Voces, we actually connect Hispanic communities, Hispanics around the country to culturally proficient and language appropriate information and services related to commercial tobacco control and cancer prevention. We also conduct technical assistance and trainings in related to tobacco and cancer, and we also promote and implement and help develop evidence-based interventions or promising practices specific for Hispanic communities. We also, one of the important things that we do as part of the program is provide technical assistance to the states and to the National Tobacco Control Program and the Comprehensive Cancer Control Program, which are the programs funded by CDC at the state level. We also work with various community partners in including the organizations that we work with as part of the program, but also through the Alliance, we also have linkages to other community organizations around the country that partner with us on a variety of other programs as well. And then we also collaborate with, like I mentioned earlier, we have a collaboration with the FDA. We collaborate with the NIH, the National Cancer Institute as well, with the universities, and also with some of the voluntary national organizations like American Cancer Society or American Lung Association, and all to reduce the impact of commercial tobacco use and also cancer that it has in our communities, and to reduce disparities as well. Next slide. Let me see if, I don't know if there are any questions here. No. So this is the website. Oh, thank you. The website for Nuestras Voces, and it has a lot of resources that you will be interested in checking out. One thing that we did for this cycle of the Nuestras Voces program was actually we made our website bilingual, so it's completely bilingual now. Before we just used to post things that were available in Spanish as well, but now we have everything pretty much available in both languages. So keep that in mind. So, like I mentioned before, some of the things that we do, we develop evidence-based interventions or promising practices to support local efforts. And on the right side of my slide, I have a tool called Prevención y Control de Tabaquismo. And then this is a tool that we developed with the program in New Mexico, the Tobacco Control Program in New Mexico, in collaboration with a community agency in New Mexico that works with community health workers. So we work with them, and they realized that there was a need for tools in Spanish on tobacco control because they were not available, those tools. So we developed this in collaboration, and now it can be used for at any state, at any state, but just it can be adapted because it's a PowerPoint presentation, so people can just use it, adapt it, update it as needed. So that's one of the things, some of the things that we have done. Next slide. A couple of other things that I want to highlight, some of our recent reports. One of them is on reduced flavored tobacco use in the policies at the state and local levels to help to reverse the tipping point of Hispanic youth use of tobacco products. And as part of our cancer activities, we also developed a report on food systems and cancer survivorship in Hispanic communities. They're both bilingual, and then they can be downloaded directly from the internet. And another thing that we did with these reports, we also develop infographics. So those can also be downloaded and printed. And it's a little easier to disseminate that type of infographics. Next slide, please. This is more information on some of the infographics that we have done. And we also do we have developed these info cards as well that we disseminate at community events as well. Because one of the things that we do with Nuestras Voces Adelante is we also leverage the other programs that the Alliance implements, and one of them is called Vive tu Vida, Get Up, Get Moving. And this is an initiative that we've been implementing for, God, I will say probably 15 years now. And this is a program where we partner with a local community agency in about 10, 11 cities per year. And we do similar to a health fair, but it's more like a health event in terms of, they provide health screenings. They do a lot of activities emphasizing healthy lifestyles, healthy nutrition, physical activity. So as part of these activities, we partner with this community agency and we disseminate the information that we develop related to cancer and related to tobacco control. Okay, so I have a question here. Can you say more about the PowerPoint? Will this be appropriate for a town hall on youth tobacco prevention? Where do I find? Okay, yes, it's actually it's a very good tool in the sense that when we partner with our colleagues in New Mexico, we wanted to be conscious of the target audience. So we wanted to make sure it represented our community, the culture, the colors, and also we made it PowerPoint because that way it can be adapted. It can be to any, because it was done in New Mexico. So of course, when you download the PowerPoint, you see that a lot of the data is for New Mexico. But if you're going to use it in Washington State, you need to adapt that data to Washington State so that it can be done as a PowerPoint. That's why we didn't want to print anything, because we wanted to make sure that it was as evergreen as possible and include some infographics as well. And then I'll be happy to provide I'll do a follow-up to Margaret, and I'll send the link and the more information about the tool so it can be used at the local level. And again, it's all information about tobacco in general, but it also has information about e-cigarettes, although to be honest with you, I'm wondering those slides may need to be updated now because there are so many new products when it comes down to e-cigarettes. But the overall information is pretty up to date, and it talks about some support for people who are trying to quit and some information about the benefits of smoking. So yes, I think it will be a good tool for youth tobacco prevention, and as well for anybody who's doing tobacco education at the local level. So I'll follow up with Margaret on that. Thank you for the question. Okay, next slide. So one of the things that I wanted to communicate with this presentation is knowing that many of you work at the community level, you work with different communities, you probably work in different public health programs. I wanted to just highlight some of the important considerations when working with Hispanic communities. Again, like I mentioned, the value of the work that we do at the Alliance is based on community-based solutions. So we partner with community-based organizations because we know they are the most effective channel to reach communities. They're already in the neighborhoods. They're already culturally proficient. They already speak the language. So these are the best partners. When you want to reach Hispanic community, they are the best partners to work with. Also, when talking about these partnerships, that means they need to be there from the beginning. They need to be at the table. They cannot just be an afterthought after you start working on a program and think about, oh yeah, we should have asked. No, to have them at the beginning, have their input, identify any community leaders that can be partners in your program. And then that way you guys can be more effective in reaching the community. And then one thing that I always like to promote during our work is the assets that promotores de salud, community health workers represent. They're also key factors in reaching communities and providing health information and getting communities involved. Because again, they're also part of the community. They are also they are good people to get community clinical linkages. They can refer people to services. They speak the language as well, and they can identify who are the most vulnerable communities in underserved communities that need the support from programs. There is also another thing that I like to emphasize, like I mentioned earlier, when I was talking about tobacco use among Hispanics, overall, we have some numbers, but when you look at by Hispanic subgroups, it's a different story. So this is why it's important to have data. When you collect data, try to collect data that is actually by Hispanic subgroups as well, because it will show you big differences. And another thing that it shows differences, for example, when you look at data like recent immigrants versus people who've been living here for second and third generations as well. So that's something to keep in mind. And then in terms of reaching community with communications with media, it's always important to have a comprehensive approach. Tailor the messaging, tailor the communications, and develop material that are resources that are, it comes for different formats. And this means, social media is good. Don't forget about radio. Our communities still listen to a lot of radio, TV, even though young people don't watch TV anymore, but the older members of the community do. And also remember that the Hispanic households tend to be they tend to have different generations, meaning from the grandparents to the children and the grandchildren. So you have to have information that is in both languages, English and Spanish. Next slide. And I wanted to emphasize here and actually highlight a couple of interventions that have been developed by our partners in a couple of universities around the country that are actually specific to Hispanic communities. And one of them is called the CDC-funded, and these are the colleagues from the University of Rochester Medical Center. They developed this text messaging where that is actually to support secession. And the interesting thing about this program was it was already tested here in the U.S. with Hispanics in the U.S., but it was also tested in Puerto Rico, and it was also tested in Mexico. So it's been shown success, and it's a program that is now being, hopefully will be released, that it can be used at the local level, or it can be used as a tool for communities addressing tobacco cessation. And next slide. And the next program is an interesting program that it was developed by colleagues at the University of Miami Medical Center. This is a pretty cool program as well. This is a program that they developed to address cessation, to provide cessation support to Hispanic construction workers. As the rates of construction workers in smoking are very high, they wanted to see how can they support the workers with cessation. And you realize that usually the schedule of construction workers is pretty early in the morning and maybe early afternoon, so they don't really have the time many times to go to a session in the middle of the day. So what this program does is that they partner with the construction companies and with the safety managers, and they brought the intervention to the work sites. So during lunchtime, the workers who are interested in getting support for cessation, they get the support, around the food trucks when they get the food, so they can also get some help with the cessation. So it's a very interesting program, and it shows, again, success as well. And the cool thing about it, too, was that they did a pilot program, and because it shows success, now the state of Florida funded them to expand the program to other places around the state. So this is something that, some of the things that are out there that can be considered as some of the evidence-based interventions or promising practices for addressing cessation among Hispanics. Next slide, please. And then just some, I will say, key considerations when we're working in commercial tobacco control. I want to emphasize again the importance of working with community partners, community leaders, to invite them to be at the table from the beginning, to gather community support. And especially when you're working on regulations related to e-cigarettes, banning flavors, and limiting access to tobacco use, you want to gather the community support. And believe me, parents, we did, the Alliance did a series of surveys with community organizations a few years ago. And one of the things that they were asked about was if parents were interested in having regulation for tobacco control among youth, and everybody was in agreement with that. So this is an opportunity to gather community partners, parents specifically. They don't want their kids to smoke or use e-cigarette products. So again, if you work with them from the beginning, you get definitely the support there. Also, again, collaboration, working with business leader, working with advocates, policymakers, university partners, And also working with youth. Youth can be a really good messenger in terms of getting to legislators, providing testimony. Those type of things actually are effective in addressing tobacco control policy. And then a comprehensive approach, and that means addressing tobacco must include like different areas of tobacco, just say, meaning beyond flavors, including menthol, raise awareness. Like I mentioned before, they need to work with parents to tell them about what's going on in terms of the e-cigarette epidemic. And then also inform community members of a price increase and how those affect how people use tobacco, restriction of advertisement, those different activities that can be done to combat tobacco use at the community level. And then also support dissemination of community-based models for cessation support as well. Next slide. Oh, I think those are questions and answers. So feel free to either unmute yourself or just some questions in the chat.
Yeah, thank you, Marcela. We'll open up the floor for questions. We're a small enough group that I'd encourage you to unmute yourself and ask your question through your mic, but you can also use the Zoom chat if you'd prefer. I'm going to go ahead and stop sharing screens so we can maybe see each other a little bit bigger. Okay.
Hi, Marcela.
Hi, how are you?
Good. Thank you for the info. I was just talking to someone yesterday about doing a town hall about tobacco cessation prevention.
Interesting, yeah.
So that's why I was asking specifically about that. So thank you for that.
Yeah.
So
Also, I will recommend you. What's your name?
Seaweed.
Okay, Seaweed. I will recommend you to check the website because especially if you're doing the town hall with youth, download the tobacco policy report that talks about the tipping point in the how to ban, like policies that actually affect tobacco use. That one is really specific to youth. So that might be useful for the work that you're doing. And again, there is also like a section with that you can download, just infographic that I'm sure probably youth will be more interested in looking at graphics than reading the whole. It's a short report, but but we're trying to like make sure the materials are attractive to different generations as well. And it's bilingual, so you can download both versions in English and Spanish.
That's great. Yeah, I'm thinking of it as yet another way for us to empower parents and families to have better communication around. So here's a subject matter. Now let's open up and show you how to have a dialogue with your kids. So that was just great timing that you had something available.
Yeah, I'm glad you mentioned that. Yeah.
And I wonder if you could just summarize. So it sounds to me like younger generation Hispanic youth we're seeing use rates that are different from what, over 25-year-olds?
Yes,
some change maybe in the last few years here.
Yeah. Okay. Yes, and it's interesting, and I think it kind of started going up mostly with the emergence of e-cigarette products, unfortunately. Yeah. And again, there are so many factors that influence that. And like I mentioned, the study that FDA did in terms of acculturation and e-cigarette use, it shows all those things about like kids are curious, they want to fit in, they want to look cool, because those products look pretty slick. I mean, if you go to, I remember I went to one time to I was in Atlanta at a meeting, and they just opened IQOS store there, and it's that it looked like an Apple store. It was all white. It looked very slick, and I'm like, oh my God, no wonder these kids are attracted to this. It was very it was for one of those pods, I guess, for e-cigarettes. But it looks so fancy. But of course, when you look at the prices, I was like, oh my God, they were charging like $80, $60 for those things. And I'm like, that's crazy. But it is very attractive to the youth. And like I mentioned from our community partners, they see always a need of educating parents, because parents don't even know how these products look. They can look like a USB computer thing for the computer. So they think, that doesn't really look harmful at all. Or even worse is the misconception that because it's vapor, it's not as bad as smoking a cigarette. In that area, for example, our community partners in New York, one thing that the program coordinator for our program in the past cycle She said she used to do rounds around the neighborhood in New York City, and she remembers there were a lot of young people using hookah pipes.
Mm.
And then she was trying to figure out why there are so many young people using them. And then she will ask, the community members, the Hispanic parents, and they will see it, is again, the misconception is not as bad as tobacco. And the worst thing is what she found out, that many parents will give it to the kids as a birthday present. And they will go with them to the hookah bars because they wanted to bond. And I was like, oh my God. But yeah, that's, this whole, and I know the hookah pipes are a part of many cultures, specifically in the Middle Eastern, I think.
Mm.
So in a way, it's kind of like, seeing that, it's cultural, it's good, it's not as bad as cigarettes. So, why not, to do it with the kids? I was like, oh boy. But yeah, but it's interesting when you do qualitative research, all the things that you learn about, these things that perhaps doing quantitative, you don't really see that. So that's why we encourage partners in the states. We encourage states to partner with community agencies because they can really help you to get the insights of what really happening at the community level with qualitative data. So, and I'm glad, like I said, the FDA is doing that. They're doing some focus groups around the country, and they were talking about how kids thought, oh, it looks so cool to use like a vape, it's like, it's kind of like, I want to fit in, and, all those misconceptions about, and the flavors, of course, that's always the main.
What do you know? Big business has figured out a way to make us want things.
Exactly.
Right.
And
Okay,
especially with those products like look really fancy.
Thank you again, Marcela.
Okay, you're welcome. Feel free to reach out to me. Margaret has my contact information, and if you need any information or any resources for your town hall, that will be great.
Appreciate that very much.
Yeah, thanks for that question, Seaweed. And anyone else with a question for Marcela?
You have my contact information, Margaret, so feel free to share with everybody.
Great. When I send out resources from this meeting, I'll be sure to share your email address.
Yeah.
And yeah, here's the nice website for the network, and
you can join right here where it says join.
Nice button to join. Looks very easy to join. That's so kind of you. And then I'm seeing a number of the things that you mentioned in your talk on this resources tab. So there's that policy handbook. I'm excited to hear about the texting program, and we'll look forward to hearing when that might come out so that it's something we can share out with people here.
Yes. I probably have, because I work with the colleagues at the University of Rochester, I'll probably have maybe a webinar with them because they're also developing another one now. They just got a grant for that. They want to develop one to use cessation support with physical activity. So that's another variation of, getting messages, promoting physical activity, promoting exercise. So it will be an interesting take on that. So yeah, I'll definitely inform you of any programs. And again, Seaweed also, this is a resource from the FDA, but it could be also a useful tool for you for the town hall, and it comes in both languages also.
Oh, that'd be good stuff to give away. Absolutely.
Yes. Yeah, you can they even actually printed those as well. You can even order copies directly from if you're interested, let me know, and I can put you in contact with the person who can send them to you. They're very quick about sending them.
Okay.
Nowadays the government agencies are not printing as much, but I know FDA printed a lot of this, and they've been very useful because our community partners tell us that whenever they have a session with community members, they take this and they just give them away to people. So
that's great.
Thank you for that. More questions for the group? All right. Well, while people are thinking, I have a question.
Yes.
You mentioned the study that caught my eye a little while ago that medical providers are not asking Hispanic and Latino people as often about their tobacco use, and they're not offering cessation aids. And then we also see that Hispanic peoples are less likely to use smoking cessation aids. And we all know how addictive nicotine is, how hard it is to quit without some help. So do you have more insights into what is the problem there, and what are some of the solutions that we could help
Yes,
educate
it
about?
definitely will help that if providers make the point, I guess. And I think it's probably getting better now because I even see it on my own. When I go to the doctor, they will ask you, do you smoke or you use drugs? Or, they ask you more about that. But somehow they, looking at different studies, and even the report that the government used to produce with the National Health Disparities Report. Every time they produce that report, you always show the same thing, that among all different racial and ethnic groups, Hispanics were the least likely that to be asked if they smoke or not. And if they did, they were not follow up with the support, like referrals, for example, to the quit line, or referrals to cessation programs, or like, for example, I'll give you a good example. The colleagues at the Family Health Centers of San Diego, like I mentioned, they are a family qualified health center. So they're actually implementing a program to work with providers to help them do the referrals to the cessation services at the clinic. So I mean, granted they have an advantage because it's a clinic, so they actually have providers, they have patients, but the clinic is also providing cessation support. It's part of the work that they do with Nuestras Voces Adelante. So then, but the fact that they have to do this program with providers to train them to do referrals, it means that there is still a need for providers to kind of remember to, hey, do you smoke? And maybe refer you to the program right there. So in that, working with a nutritionist, they're working with health educators, they're working with physicians, nurses, physician assistants, for them to refer the patients that they see to cessation support when they need it. And it's been pretty successful in the sense that I guess, again, we still need to train physicians and other health providers. It's like, wow, we need to do more work on that. And also, and they were the ones also who told me about some of the misconceptions that they have heard from people about NRT. Many of them, they have no idea those things exist. Those type of support for cessation exist. And sometimes they believe it's another medication. They don't want to take another medication, or they feel like I mentioned, my colleague mentioned that some people mentioned that it was a sign of weakness, that they want to do cold turkey, that they can stop smoking cold turkey. They don't need any type of medication. But the fact that they want to quit is a really great opportunity to implement cessation. And like I mentioned before too, they talk about the importance of quitting to protect their families, to protect their kids. So that's another important thing to keep in mind, specifically if you want to do any campaigns related to cessation and messages, positive messages for the community, like we have done in the past for Hispanic Heritage Month, talking about leave the legacy to your family. We have done messages on stop smoking. That's the best legacy you can leave for your family, for your kids, things like that. Make it like a positive way so it will resonate with the community members.
Thank you for that.
Yeah, I think it's a lot of education still out there that we need to do to support. And specifically now that there are a lot more, the kids are using these e-cigarettes, we definitely need to keep with the messages.
Yes. This is also part of our coalition's messaging about why supporting prevention and cessation programs is so needed, or more state funding for that, because
oh yeah,
it needs to be continual, and it needs to come from various sources, and that takes resources too. And yeah, absolutely. Other questions or thoughts from folks? Well, maybe I'll wrap up with asking you another question. I know you've been working in this arena for some time, and in recent years, I've seen more emphasis on addressing disparities. I've seen some, I saw some wonderful speeches and discussions as part of the Cancer Moonshot on, really focusing on reducing tobacco use, especially in the communities that are more impacted by tobacco industry
Yeah.
targeting and by use. But do you see that we're going in the right direction, or how do you see where we're at with this work? And are you hopeful, or are you feeling like we really, or what's your perspective on the
No,
future?
I was really happy to see that with the Cancer Moonshot and the emphasis that at least at this time the federal government is giving to tobacco cessation, that is being incorporated into all the different departments in different ways.
Yes.
I see definitely, I feel more hopeful with that because it's kind of getting it out there, because sometimes we think, yeah, the rates are going down, but no, we still have a lot of community targeting by the industry. Sometimes it's very settled that we don't know that is happening, but it's happening. And like I mentioned before, also the sponsorship still of community events from the industry with the community, because there are no resources out there. So they provide the resources that are needed at the community level, but unfortunately they come from the industry. So no, there is definitely more emphasis. And also the fact that we're becoming more and more aware of the impact of smoking and using tobacco that it has on cancer. I mean, it's not only one cancer, it's pretty much every cancer is associated, with use of tobacco. So that's also an important part. So I'm glad that is that is getting more out there in addressing the disparities, because we definitely need to address that when it comes to like mental and how that affects the communities. We're seeing, for example, that in terms of mental, research is also showing that among certain Hispanic groups, menthol is used a lot more than other type of cigarettes. So again, it affects all communities, and the disparities need to be addressed, because when you look at the rates of chronic conditions among some groups are more prevalent than others, and especially cancer, for example. Yeah. So we have to be optimistic.
Optimistic and persistent.
Exactly. Oh, yeah. Like I said, until we get to the point, like we were talking earlier, until we get to the point there is no more available tobacco product. If we ever get to that point, that would be great. That would be the end goal, the ending tobacco use.
Yes.
At every level. So
I'll do one last call. Any questions?
no
Well,
problem. They can
yeah.
send me questions afterwards, and I'll be happy to provide any resources or information. So I hope the information was useful, and I hope if you guys need any type of support from Nuestras Voces, feel free to reach out to us.
Thank you so much.